Hi, hello, my name is Jonah Nagel. I am a student of the Doctor of Chiropractic program at Parker University, and I'm currently in my third trimester of the program. Today I wanted to talk a little bit about what chiropractic is and what chiropractic care looks like to potentially a new patient or someone who doesn't know a lot about the profession and what it looks like to be a chiropractor. Now, chiropractic is a profession that is holistic in nature, meaning that we're not relying on medications or surgeries, and we're really interested in assessing the body as a whole instead of just like you have an injury to your back and we're just going to focus on that. We're going to look at everything that could be impacting that, and that could include diet, sleep, lifestyle habits, posture, gait corrections, and then things like the adjustment, which is kind of the bread and butter of chiropractic. We're like we're really focused on the musculoskeletal system as a whole, not so much pathologies or anything like that. It's not necessarily in our scope of practice, but if it's a musculoskeletal issue and there are things like maybe diet or sleep that are impacting that, that's something that we would address within that holistic approach. Because we really do believe within the profession that the body is a self-healing organism, and it can maintain itself and correct issues very well as long as there aren't any underlying things like maybe joint restrictions or subluxations, which are believed to have an impact on the nervous system's ability to regulate the body and everything that it does. So most of the time, chiropractors will use what's called the adjustment to address these joint restrictions and subluxations. Now, a subluxation is, and a lot of people don't know what it is it refers to a functional or structural joint dysfunction that may impair normal joint motion and potentially affect nervous system function. And these are assessed through motion palpation, and assessments, different assessments that lead us to the conclusion of subluxation or joint restriction. A joint restriction is assessed through motion palpation as well, like how well the joint is moving in the proper orientation of the joint facets. Now, to correct these, we use what's called the adjustment. Now, the adjustment is a specialized manual manipulation that is chiropractic specific. It uses short lever arms instead of like long lever arms, which like osteopaths use. And it's most commonly used to reduce or restore motion, improve mobility, restore function, and it can reduce pain and stiffness in an area. Most common treatment areas are related to the spine, like the neck, mid back, and low back, but extremity adjusting is also used in chiropractic. I mentioned it a little bit, but benefits of chiropractic care are most commonly going to be relief and improved function of joints. So maybe relief from back pain, neck pain, headaches, stiffness, and it can improve things like mobility, posture, flexibility, and daily function. Now, chiropractic isn't just used for people who are in pain. It can also be used to maintain daily lifestyles and help people keep doing the things that they love. Now, a lot of people do have fear of chiropractic, and I've got to wrap this up, but it is a very safe profession because chiropractors are licensed healthcare professionals who go through extensive education and clinical training to be able to perform specialized manipulations called adjustments.